And now 30 at 6 welcomes another service that our viewers may not know about but could be very important. Welcome to Tina Marie Brown and Carol Masden from Mobile Crisis. Carol, tell us a little bit about your role and what your agency does.
Good evening. Thank you so much for having us. We feel so blessed to serve the citizens of Cecil County, and it really is attributed to your health officer, Stephanie Garrity. She is such a champion of ours, and our company is affiliated Sante Group, and we're the Eastern Shore Crisis Services Division, and we've had mobile crisis services actually right here in Cecil County for 5 years, thanks to your health officer, Stephanie Garrity, and your county council. They fund a portion of the mobile crisis and a call center. The call center is available 24 hours a day, 7 days a week to every person in Cecil County who might need mental health or substance use support by calling 888-407-8018. And we have a mobile crisis team available in Cecil County 7 days a week that's free. Doesn't matter if you have insurance, if you don't have insurance, if you have lots of money and live on the water, or if you have lived in a very small home and you are aspiring to live on the water.
Right, like many of us.
Exactly, like many of us. Then you can call the Mobile Crisis Program, and the Mobile Crisis team can come to your home if you are experiencing issues. A team of 1 or 2 clinicians can come and help, or we can meet in the community. Tina, do you want to tell a little bit about how that program works?
So I'm in charge of the daily operations of the mobile crisis team, so I work directly with the clinicians, and I also actually still go out in the field myself. So when we receive a call, we'll meet the person, and we can meet the person anywhere. If you don't want us to come into your house, that's fine. We can meet you at Wawa, we can meet you at Rural Farms, we can meet you at the library. And we'll sit down and talk with you. We'll want to find out what the problem is, and then we'll help you develop solutions. We like to connect people to as many resources in the community as we can. We deal with substance use disorders. We deal with mental health disorders. We deal with a lot of children that have behavioral disorders. But we will link people up to the services they need, and then we will follow up with them for a week or 2. In Cecil County, we're actually lucky. We have a special program for a child and adolescent children, and we can follow those cases as long as we need to. As long as the family needs support, then we can continue to offer that to them.
And Tina, because you cover the entire shore and
Yes.
beyond even, you pretty much know or need to know what's available, say, in Cecil County.
Right.
Exactly. And Affiliated Sante Group, our parent company, actually is Maryland's largest provider of crisis services. We cover, our Eastern Shore division covers, as you mentioned, the call center covers from Cecil County down to Worcester County, and our mobile crisis program covers from Cecil to Somerset. And Affiliated Sante Group's crisis programs cover Baltimore County, Prince George's County, Carroll County, and we're actually really feeling blessed to now start covering Harford County. So, so those are the things that we're able to do. We, with Cecil County having made an investment of $200,000, we actually have, last fiscal year, we diverted 215 people from, meaning we kept people from the hospital, and according to some of the programs that we have seen, we feel that we have saved Cecil County over $470,000 by keeping those people out of the hospital, at least that. So we feel that we bring a big return on the investment that Cecil County has invested in us. We give people quality of life, we help to bring linkages to resources, and And we feel really fortunate to have great partners like Sheriff Adams and Chief Donnelly with the Elkton Police Department, Chief Brooks with Emergency Services, with the Drug-Free Cecil program, and Ken Collins and Mike Masuli. I mean, just great partners here in the community.
Well, that's always great to hear. And you kind of answered one of my questions. You said 215 people have been diverted thus far this year in Cecil County.
That's just from the emergency room.
Right.
Well,
And that's just for Cecil.
we actually went out to what we call dispatches. We actually did a total of 706 dispatches.
Wow.
But we calls for service, but actually 215 of those folks would have gone to the hospital if it were not for our services.
And that's kind of one of your goals, is to prevent that
We want to keep
level.
people from going to the hospital. That being said, if we really think somebody does need to go to the hospital, we will go with them.
Right.
And we will talk to the charge nurse, the behavioral health team, the doctor, to let them know what's going on with that person and why we can't keep them safe in the community.
Well, that only makes sense because if somebody's having a freak out, for lack of a better term,
Absolutely.
and they can't really describe what's going on, having your objective input is probably really crucial.
Right.
Exactly, because families, if this is the first time or the third time or the 10th time for that freak out or whatever is happening with that family, they need that support. They
Right.
need that. And even if it's law enforcement, they need that help and that support. And, we feel really blessed to be able to partner in those times.
And that's something, how do you partner with law enforcement?
Law enforcement will call us if they have concerns about someone, or maybe they've been out to Mrs. Jones' house 6 times this week because she thinks there's people crawling around in her attic. They will call us, and then we'll go out and try and work with Mrs. Jones. We'll try and set up with services if she'll allow us to. It's a voluntary program. And we will continue to offer her to support. Something like that, we might try and get Mrs. Jones to call us instead of the law enforcement. If we go out in a neighborhood that we think is not safe, the police will go with us, not to arrest anybody, just to make sure everybody's safe. And they'll do what we call a well-being check, and they'll go with us and they'll make sure the scene is clear and safe for us, and which is a big help for everybody.
Well, I'll tell you what,
Right.
So how many years have you been doing this now in Cecil County?
We have been providing the service 7 years in Cecil County, but we've actually had a team here for 5 years. So we're really excited that this is our 5th anniversary in Cecil County with the team.
Well, again, folks, the service is out there. It's free. And what's the contact number again?
888-407-8018. And it's free.
Great. Thank you both.
Thank you.